Hello and welcome to Bottom Line. Well, a fresh case in Manipur has yet again served as a reminder that Northeast is probably facing its next challenge as far as the COVID situation is concerned, with thousands of those stranded outside the region now returning home. While states need to be constantly on guard, there is no question, mind you, there is no question of opposing the entry of people to the respective states, as those coming in are our own people. Focus rather should be completely on capacity building measures and generation of awareness, which will help us gear up for any eventuality. Is this happening in all states? That's the question we are asking tonight. Are people skeptic about what's in store in the next couple of weeks? Is awareness and appropriate capacity building the only way to meet this challenge? Do our lawmakers, do our authorities realize this, and do our people also at the same time realize this? To carry the discussion forward, I'm being joined from Shillong by Meghalaya Minister James Sangma. Also joining me from Shillong is John Kharsing, Chairman of Grand Council of Chiefs, Meghalaya. Dr. Lenin joins me from Imphal. He is with the RIMS Hospital Psychiatry Department. In the studios, I have Dr. Sangeeta Datta, psychiatrist. Very big welcome to all of you to Bottom Line. James Sangma, I know you have to go. I'll come to you first, James. My first question to you, Mr. James Sangma. As we all know, following the announcement of the special economic package, Prime Minister Modi had urged states to improve the supply chain and to think local. So Meghalaya, as we know, has a lot of agricultural produce. So any plans in place as far as improving supply chain within the state is concerned and giving a boost to local economy? I'm asking this because you're the Food and Civil Supplies Minister. So just digressing a bit at the very beginning. James Sangma.
Yes, absolutely. I think it's a very pertinent question that you have asked just now. And the COVID situation has actually brought a lot of realization, I believe, not just to our government, but to governments all across the country and maybe in the world, that we have to start looking at such kind of situations may come up in the future, and how do we cope up or how do we react to that. And I think one of the very important factors that we have to take into consideration is that the supply of food and essential food items, that has to be really put into a very sharp focus. And in that line, we as a government have started thinking about how we can improve our internal chain, how we can improve upon the supply that we need to maintain despite any kind of crisis that may come up in the future. So these are very pertinent points, and these are things that Government of Meghalaya has started thinking about. And this is about this is directly linked to food security. And I think that it would be foolish on anybody's part to really ignore food security from a very localized point of view. So this is something that we are starting to think in a very serious manner.
Absolutely. And Mr. James Sangma, do you think a state like Meghalaya, which has a comparatively small geographical area than the other mainland states, where of course we have villages right on the outskirts of the city as far as Meghalaya is concerned. So if the state can put proper focus on agriculture, chalk out a plan, proper agri plans in place, do you think Meghalaya can have an advantage when compared to other states because of the small distance of transportation, and maybe also lead to encourage more? This will lead to encourage more local produce?
Absolutely, because we are a predominantly agrarian society, and most of our local economy is based on agriculture. So since the majority of our population is engaged in agriculture, it makes complete sense for us to facilitate the process in terms of production, in terms of marketing, in terms of market linkages, and we are looking at strengthening this agrarian sector in the state of Meghalaya. We've always been doing that in the past, but I think now a special drive and special focus needs to be taken into consideration now.
And how do you see the current supply chain in the state besides Meghalaya's stock of essentials, Mr. James Sangma?
I would say that right now we are comfortably placed in terms of the staple food is rice in Meghalaya, and in terms of rice we have adequate stock to tide over the present crisis, and I think that that right now the supply chain is also such that earlier there were certain hiccups that took place because there was a disruption in the logistics, but now things have smoothened out, and more or less people, the feedback that we take from the general public, we can easily gauge that right now things are in a much stable and comfortable position.
And my last question to you, Mr. James Sangma, again, as I mentioned in the beginning, hundreds from the state, thousands from the state who were stranded outside are now returning to Meghalaya. That's a big challenge for the state health department, a big challenge for all frontline workers. Meghalaya, of course, has been screening them, will be screening them, and is also likely to conduct rapid tests on everyone before they are sent to home quarantine. However, don't you think there is also a risk factor involved in sending them to home quarantine, as they're coming from, they will be traveling long distances? So do you think Meghalaya should also maybe make an attempt, like states like Assam, Manipur, Arunachal, to possibly put everyone in facility quarantine, even if it is for a short period of time? Of course, no denying to the fact that it's not easy by any means, but still.
Correct. If you look at institutional quarantine vis-a-vis the home quarantine option, well, both have their merits and demerits. It's just a question of, for us, we have gone through both the options, and for us as a government, we have chosen the home quarantine because it may have its demerits, but then as per the given situation, I think that this is the most suitable model for us. Of course, there are risks involved. We are very, very aware of that. And we are taking extra precautions in other ways, constantly calling them up. We are monitoring each and every person who has come back and is in home quarantine. So we are putting into place other mechanisms whereby we can monitor the situation, and hopefully that that this does not result in some kind of loose cases which may transmit this disease unwittingly to someone else. So we are taking those precautions, and as I said, each process has its merit or demerit, but we have chosen this method.
Absolutely. Thank you so much, Mr. James Sangma, for joining us. That was Mr. James Sangma, the Meghalaya Food and Civil Supplies Minister. If I can go to Dr. Lenin. Dr. Lenin Imphal, thank you so much for joining us. Yet another case, positive case in Manipur. The state was COVID-free for close to 3 weeks, over 3 weeks now, and then yet another case. But then, cases are increasing across the country, and we have to be prepared for them, don't we?
Yes. Good evening. Thank you very much for the opportunity given to us. And you have rightly said that we were very, for a period of 2 to 3 weeks, we were very happy that we are in the green zone. But unfortunately, yesterday we have a positive case identified, who is a returnee from Mumbai. And many more people are also arriving from different parts of the country. And many of these places are also from the red zone, and we all understand that all these people stranded in different parts of the country are our own sisters and brothers, and so we cannot deny them access to their homeland. So now the situation is that we are supposed to fight together, and we have to accept the inevitability, accept the inevitable, because we all know that when many people are coming from different parts of the country, and considering the magnitude, the number of people, our infrastructure and the preparedness has to be equal to the number of people who are coming back. But because of the short notice and the existing infrastructure, this is really a challenge. But we have to prepare mentally and also to develop the infrastructure.
Well, at least, Dr. Lenin, at least Manipur has been able to put into facility quarantine close to 1,200 people. That is also something remarkable for a small state like Manipur. Would you agree?
Yes, yes. Our government, and with the support from everyone, and we are preparing in such a way that we would like to accommodate them as far as possible in the institutional quarantine, or at least in the community quarantine. And most of the NGOs, CBOs, and the local MLAs and the other people are putting forward their best to support in this regard.
Absolutely. Dr. Sangeeta Datta, again, you know, we had Manipur was a COVID-free state. Now we have another case, and also hundreds are coming back to Assam. Even the state health minister had to face tweets and questions as to, and even asked during the press conferences, why are we allowing people to return? That's a question everybody's asking, but probably not a pertinent question. I mean, people have to come. You know, staying put where they are is not an option. We may say, okay, stay there, stay in your respective states. Probably financial assistance will reach you. The government can send some money, but we are not getting it. Probably it's not that easy. Stranded in a state, probably half of them are jobless. Probably half, you know, the landlords want half of them out of the rented accommodations. We don't know what problems they are in, so we cannot be the ones to judge whether or not they should be allowed entry or not, and that discussion should be put to an end. There is no question of you know, trying you know, asking people not to come.
Absolutely. The Health Minister of Assam, Dr. Himanta Biswa Sharma, I remember he had said that we anticipate another challenge when these people from Assam who are outside the state will return one day. And like as you said, I completely agree with you when we say that there's no question, actually it's not a pertinent question at all when we sometimes debate over the issue that whether they should be allowed to come back or not, because it's about human rights. They belong here, they will have to come here. They had never planned to stay outside the state. They had never, the people who were stranded outside the state never thought that COVID-19 would happen. They never thought about, nobody could actually dream about a lockdown also the way we had. And now when people are stranded outside, like you have said already, that we don't know what situations they are in. Some people, I have heard, that some people actually came halfway to another state. They were on their way home back, but they got stranded somewhere else and they had to take another rented apartment. So ultimately, we have to bring them back. It is this place that they belong to. But as discussed already time and again, that it's about capacity building, it's about fighting together, and it's about you know, identifying the positive cases or putting them into institutional quarantine or home quarantine, and following the norms, following the guidelines, and yet you know, fighting against COVID-19 and winning the war. It's not even a battle now. So it's, the questions are not about whether they'll come back or not. They'll definitely come back, but what do we do once they come back? That's the real issue. And I think the government and also the other, you know, everybody, every citizen is cooperating with the government currently, apart from some sections of the society where we still get to see lack of awareness, which is very unfortunate. And all of us need to cooperate with the government so that the people from our state or from its state who are outside, they can come back home and yet stay safe here with us.
John Cushing, I'll come to you. I'll come to you in a short while, but I would like to go to Imphal once again to Dr. Lennon. Dr. Lennon, as of now, the state government, the Manipur government is putting everybody compulsorily in facility quarantine. But as the numbers increase, we already know the Chief Secretary yesterday informed that more people are coming, more stranded people, more trains are on the way. So we can expect another 1,200 to 1,500 people arriving in the state in no time, or maybe more. Once the numbers increase, it will get increasingly difficult to put everybody in facility quarantine, probably in Imphal. But do you think that's where the state government also has to, in a way, let some people go directly to home quarantine because there's no other way, and that's where the awareness levels have to rise? If people are scared that there may be more cases because people are coming from outside, generating awareness becomes that much bigger a challenge.
Right. As many more people are coming, then the challenge will increase. But majority of our the think tank and the policy makers are considering that as far as possible will somehow keep them in the institutional or community quarantine. And sending them back to home quarantine will be the last resort, and most probably we will take it as a last resort. And as I have rightly said, the awareness is the most important tool now, and the honesty and sincerity of each and every citizen, because this fight is a fight which everyone has the equal responsibility. And if anyone cannot be left out, if someone is not honest and someone is not doing their acting responsibly, then that mistake, the fallout will be shared by each and everyone. So now the time is every citizen has to take their own responsibility and act responsibly. And for that matter, we have to do a massive awareness from to different parts of the different strata of the community. And sometimes some sections of the people, out of the panic, out of the extreme apprehension and worries, they would be resisting sometimes to the healthcare providers or frontline warriors, for example, the police personnel, sanitary workers, and the long distance truckers, etc. But now people's awareness level has gone up, and everybody has come up with some altruistic activities, then solidarities, and these social activities servicing to the people who are in need. This is increasing day by day, and it has become a positive aspect of this challenge, and it has bring out the goodness which is there in the people is being brought out. This is the positive aspect of this challenge, and it is being increasingly seen in our state, and hopefully in with the increasing awareness and the participation of each citizen of the state, the challenge will be handled properly.
And also,
and successfully.
Yeah, also Dr. Lennon, well, you yourself are in RIMS, of course, not in the COVID section maybe, but you are with RIMS. You have been associated with the doctors there. COVID, one of the COVID positive patients was also admitted there. Initially, when the first case came, of course, there would be a sense of nervousness that is there. I mean, that is true for any state. Now, if at all there is a second wave, we pray it doesn't happen. Yes, there is one case, that is okay. The good thing is that the person was already in quarantine, so he has been directly admitted to Jennings, and I'm sure in 2 weeks' time or even less than that, he would be cured and released. But now, do you see your colleagues, your co-workers, your fellow doctors more prepared mentally for the challenge than what they were probably a month back? Do you see that change from the psychological point of view?
Yes, of course. We are in the first instance, this was in the preparatory phase, and we were not fully prepared. It came without notice, sort of. And now with the passing days, we are more prepared both mentally and physically. That means the infrastructure and other preparedness has been increased, and now sort of our RIMS is also fully prepared.
Absolutely. Mr. John Karshing, Chairman of the Grand Council of Chiefs. Mr. Karshing, as we all know, hundreds of stranded people from Meghalaya are returning from outside the region, and the state government has decided to send them to home quarantine, of course, after screening and even performing tests through rapid testing kits, as far as we know. Do you think it's a good idea at a time when the numbers are rapidly increasing everywhere in the country and many of these people are traveling long distances? We had the State Food and Civil Supplies Minister in the show a short while back. He thinks that, well, the government is keeping in touch with everybody, so things would be under control.
I would say this is, in fact, we have written to government to suggest that they should mandatorily quarantine. It's a small inconvenience to, to pay for the safety of everybody, for the safety of those returning and their own family. So, it is for their safety only. So I would say that, sending them home is not such a good idea. I would suggest that we are pleading to the government to kindly consider all the people who are coming back. The darbars have come forward, the traditional heads have come forward, but I feel in some areas they're doing it, in some areas they're not doing it. So it requires government coordination of all this, not to leave it to the Darbashno, because Darbashno can basically monitor to a certain extent. The point here being that even the rapid test which is being done, right? There are some issues which have been raised earlier.
Yes, in the past.
And the idea of screening, all this effort of rapid tests, and the other known thing is that your symptoms could arise much later. So if they've already returned home, then now you have a larger problem.
So, Dr. Sangeeta Datta, well, the confusion persists. Of course, there's not enough choice also in front of all the state governments. They are trying their best, no denying to that. Every state government, every health department of every state would want to ideally put people into facility quarantine. But that is not possible in a country like India. We fully understand that. But wherever possible, probably efforts should be made. If my question is, if a state like Assam can do it, if a state like Assam can,
Yes.
After what we saw after the Ajmer return, the bus thing happened, the state decided that everybody who comes in will be kept in facility quarantine at least for 3 days.
Yes.
14 days is not possible with the inflow, but at least for 3 days they can be put in facility quarantine. So probably an effort should be made. But again, putting everybody in facility quarantine is also not the solution, because numbers may increase. We may have a time when, as we see in the case of Maharashtra, increase of 700, 800, 1,000 cases every day. How many people will you keep in facility quarantine? So we, keeping those in mind, probably, a home quarantine, letting people go to home quarantine is probably, we can look at it as preparing for the future. But when you talk in the context of Northeast, we can clearly see there is a sense of panic, underlying sense of panic that still remains.
Yes, absolutely. Sending them straight away to home quarantine would mean that without proper awareness, because we are still not sure if everybody is aware to the extent that they should be. And it would mean that we are actually putting all those family members, children and other family members at risk, because we have been discussing this. Not all of them are symptomatic, a lot of them are asymptomatic carriers. The rapid test again has its own issues. We are not too sure about a lot of things. Too early to, of course, comment also on that. So it is always safer if we can afford that. If of course, with overwhelming number of people coming in to the state, a point might come when we may not be able to provide facility quarantine to everyone. But when we can, till the point we can, I think it should be done. But again, when a government decides of a particular state to resort to a particular measure, I guess there are sufficient reasons. They must have analyzed the risks and the benefits too. There are multiple issues perhaps underlying. this decision, and the government and the other responsible bodies and people from that state would know it best. But for an outsider, to an outsider like me, I see a lot of risk if people are allowed to go straight away to their homes for home quarantine, because it's slightly scary, I guess.
Probably, but of course, as you rightly said, the respective governments must have weighed all the options and probably did the best
They
thing.
must
We'll
have
have to
done
take
a
a
proper
very
analysis.
short break here. Stay tuned. On the other side, more people will join us. Welcome back. You're watching Bottom Line. We're discussing the current situation in the Northeast, the COVID situation in the context of hundreds returning each day, those stranded outside the region. If I can go back to Dr. Lenin in Imphal. Sir, at a time when we are talking about awareness, the heartening thing is that we have got reports coming in from remote corners of Manipur that villagers, rural people themselves, without any government help, are making quarantine centers, quarantine huts. So, well, that implies awareness is there. The health department, the government just needs to give the boost, probably extend some funds wherever required and encourage. That's not too much to ask for.
Right. In Manipur, recently it's being responsibility is being given to different MLAs and different CBOs and NGOs, different constituencies, and they are supposed to take equal participation in the management of these returnees. So that's why they have started preparing their community quarantine in different parts. They, for example, in some of the hilly places, they construct huts, temporary huts in good numbers, and they are actively participating with or without the contributions from the government side. And it is a very good initiative or participation from the community. It's a very good sign. And of course, the awareness level is also increasing day by day. At the same time, we need to give more transparent and concrete awareness, because this COVID-19 is an evolving medical challenge, and every moment, every minute, this is changing, and the strategies are also changing, considering the practicality as well as the evidence-based this research findings coming in every day. So the awareness has to be given in a continuous basis. One time is not sufficient.
Absolutely.
And a different level of awareness to the different strata of people are this thing required. And we have different dialects, more than 29-30 dialects.
Yes.
And we have entrusted to, it is the best thing is to entrust to the local people to spread the correct and the very simple message, which will save many lives, and also encourage people to participate actively. As I said before, it is the fight, the solidarity, and the collectiveness will be the mantra to a successful fight of this type of challenge of huge
Very
magnitude.
nicely put, sir. My last question to you. In the last 24 hours or in the last 12 hours since the detection of the case, did you notice, observe any sense of underlying panic in the state in your dealing with people so far? What do you gauge? How do you gauge the situation?
Yes, of course, after a period of complacency sort of thing, people, as the enemy is unseen, they have a very, what to call, sense of security, of sense of confidence that we will remain green ever. But the situation is changed now. We are in the orange zone. So apprehension level to each and every section of the people is increasing. At the same time, we have to send a message that we have to accept the reality, and we cannot run away from this situation. So this awareness is continuing, and hopefully in a few days time, then people's panic and fear will be converted into awareness and preparedness to face the challenge.
All right. Thank you. Thank you so much, Dr. Lennon, for being on Bottom Line. Thank you so much, sir. Thank you. As we just said, that reports are coming in from parts of Manipur that, especially the rural places, people are making their own quarantine facilities. We would like to show you this report, this very special report from Senapati district of the state.
The war against COVID can be won only with community support. This message has been wide and clear for quite some time now, and a village in Manipur's remote corner has set an example in these lines. Tungjoy village under Paumata subdivision of Senapati, located near the interstate border with Nagaland, has built over 80 huts to be used as quarantine centers for returnees. The village authority did not wait for any government help to build these huts, but went on its own to put up the facilities. The village authority, along with the local divisional officer, put up the necessary infrastructure. Each hut will accommodate only one person and has an attached toilet, gas table and electricity. Water supply is being provided at various locations, and ration has also been stocked up for the mandatory 14-day quarantine. Moreover, 12 feet gap has been kept between cottages, keeping social distancing norms in mind. Not only this, even the cottages have been classified into 3 categories to accommodate people coming from green, orange and red zones respectively. Moreover, 3 information centers have also been set up for better communication. During the stay in the quarantine center, food and other requirements will be arranged by dedicated volunteers listed for the task.
I, as President of Tungjoy Youth and Student Organization, so under the direction of Ministry of Home Affairs, with the Tungjoy village under the district of Senapati, district Manipur, we constructed 80 huts for the quarantine. We spent around 2 to 3 lakh for constructing this quarantine center. So after the fight of this COVID-19 pandemic, I, on behalf of Tungjoy village people and also on my own behalf, would like to appeal to the government of Manipur to kindly recognize this quarantine center as one of the tourism spots.
Manipur Chief Minister N. Biren Singh had earlier retweeted photographs of the quarantine huts that was posted on social media by Donor Minister Jitendra Singh and lauded the village authority for the infrastructure. The initiative thus has garnered a lot of praise from several quarters. It may be mentioned that Tungjoy is a border village 35 kilometers from district headquarters Senapati and 112 kilometers from Imphal. Around 100 villagers are believed to be stranded outside the state, of which 2 reached the hamlet from Chennai on Wednesday. As per plans, these huts can be later used for tourists visiting the area. A unique initiative indeed. With inputs from Samuel Pao from Senapati, News Desk Report, Northeast Live.
Great initiative there by the rural folks. If there is community participation, everything can be achieved. We are also being joined from Shillong by Dr. Senrang Warjri from Nazareth Hospital. But before I go to him, Mr. John Kharshing, let's say, for instance, let's say it's too late maybe to plan a facility quarantine for everyone, as people have already started coming in as we speak. I'm getting information that a train carrying the first batch of stranded people from Meghalaya has already arrived in Guwahati. But again, maybe say some of the localities, the Dorbars decide to do it on their own. Say the Dorbars decide to make their own quarantine facility in some of the states. Do you think at least in the Shillong agglomeration there would be enough space available to put people in facility quarantine in their respective localities if the Dorbars want to do something like that? Of course, they would need help from the State Health Department.
Yes, that is why the state government should have come in much in advance, map out all the logistics. And in the city, I am sure that there are many locations. Uh, if I'm not mistaken, the hotels themselves, of all categories, can accommodate, just the hotels, I think, can accommodate at least around 1,500 people, you know. And had they staggered the return in coordination with the government of India, then you wouldn't have had everybody coming at one time. So even now, I guess it's in a staggered mode. But I guess there are so many schools. In fact, the churches have come forward and offered their assets, right? The churches much earlier came, the church institutions, the schools, colleges. These have there's a lot of vacancy right now, which could have been utilized and which they can still do if they take a call now to convert these into quarantine centers.
And Mr. Khashing, what we have seen in the case of Manipur, the latest positive case is a person who had just returned from Mumbai. So since Manipur is putting everyone in compulsory facility quarantine, so accordingly he was immediately shifted to the hospital from the quarantine center. No immediate need of contact tracing. So clearly facility quarantine definitely has its advantages. But having said that, it's not easy by any means to put everyone in facility quarantine. Let's be very clear about that too. But nevertheless, as far as possible, as long as we can do it, should not it be tried out? Because the people who are coming in are traveling long distances, so the risk factor does remain. That's what we have been discussing. What's your view on that?
Yeah, this is exactly what we were trying to say, that it requires only one person to come in and become positive, and then all hell breaks loose. So this is what Manipur government has done. It is painful, no doubt. It is very difficult. It is challenging, but nothing can be, nothing is impossible. It can be done. If the government puts in its effort, it can be done. There are so many facilities all around the state where you can put them, and the pressure is at this initial stage when everybody is coming back. We've got around, we don't have the exact numbers, but they're saying is over 10,000 people will return. So, and in fact, the government yesterday, one of the government ministers yesterday or day before mentioned that they're considering everybody who's returning as a returnee from a red zone area. So what furthermore would justification would you require to adopt a strategy? In fact, I'm suggesting to the government, there are 60 MLAs here, all the 60 MLAs get together, each take care of his own constituency. It should be done. They have the MLA funds, they can do it. Create a constituency committee with the respective MLA as the chair, to further help the government agencies in coordinating all this matter. Because the MLAs right away would know what all the institutions are there, what all are there. Even the government also would know. So I feel like, instead of just relying on good faith, here there's a huge risk factor. The other issue we must remember carefully, the earlier returnees were from Northeast. Now, the entire Northeast, the total number of infected persons was below 150.
Of course, keeping the
Whereas
Tripura
if you
part apart.
look at the returnees from outside of Northeast, they would be coming, if you look at the scale of that infection is very, very huge. Very, very huge. So I don't know whether ideally, we should not be taking such a risk.
Okay. It's confirmed now. The first batch of stranded people who are residents of Meghalaya have reached Guwahati. It's close to over 1,000 people from Meghalaya have reached Guwahati. They had boarded the train in Chennai, and of course, we are getting reports there are MTC buses in the Guwahati railway station who will ferry these stranded people from Guwahati. So that's the breaking news. The first batch of stranded people from Meghalaya who have returned from other parts of the country. This train, of course, has come from Chennai. and the first batch has reached Northeast. The first batch of people, over 1,000, close to 1,100 people have reached Guwahati, and they will be headed towards Shillong. MTC buses reportedly are in the Guwahati railway station, which will be ferrying all these people. So as we're talking about hundreds and over thousands returning every day, we have had people returning to Tripura, Assam, Manipur, Arunachal Pradesh, now Meghalaya. The first batch of returnees as far as Meghalaya is concerned have reached Guwahati. They're in the Guwahati railway station right now as we speak, and of course MTC buses, the Meghalaya Transport Corporation buses will be ferrying them to Shillong. And also Assam Health Minister Mr. Himanta Biswa Sharma is also reportedly at the railway station. He has been everywhere, be it Meghalaya, Assam. He's been in the aid, helping everyone out, coordinating everything, monitoring everything at the thick of action, always round the clock, and has really shown the way a health department functions. Probably everybody can take a lesson or two from him as far as the Northeast and the entire country is concerned. So that was the breaking news. Dr. Sendrang Warjri, the first batch of returnees from Meghalaya have reached Guwahati. They will be on their way to Shillong. What we had been discussing is that facility quarantine and home quarantine. Of course, Meghalaya has decided to send majority anybody who's not showing symptoms to home quarantine. How do you see that? Could the government could have done differently, or maybe considering that home quarantine is the way forward, let's go for it from the very beginning? What would you say?
I think facility quarantine is always better. Instead of just advising people to stay home, to enforce is better. Tell them to, you make sure that they stay for 28 days at a facility, number one, and then you can also detect which among them is symptomatic, suspected. You can send them for testing. Anybody is positive, you can isolate them. So it works faster. So definitely they should have done with the facility quarantine, and it's a lot of people coming in, but I think they had the time, and it could have been planned properly, and they could have arranged proper places for them to be put in quarantine. So I think putting them in house quarantine is a big risk.
Well, again, Sangeeta Datta, again, there are two varied views even among doctors, but don't you think possibly it's time we actually prepare for the longer haul, which is the home quarantine? Because eventually we may have to do that. I pray we don't need to, but we may have to do that. And it's also eventually the society. The report that we had just a short while back, the villagers making their own quarantine centers, that is all about community participation, and home quarantine is also about community participation. Of course, those who don't have the wherewithal to be in home quarantine, probably not enough space, is the state's duty to help such people. Otherwise, maybe home quarantine should be the way forward.
As I said previously, sending them home straight away, it carries a lot of risks. And I'm not too sure at this point of time how much of awareness these people have to receive these members, because other family members' health is also at stake that way. But again, as I said, that when the government of a state decides to go for home quarantine, I'm sure there are reasons as to why they have decided that way. And I'm sure they have analyzed the risks and the benefits, and they have gone ahead with that. But all this while we were talking about home quarantine and facility quarantine. Today we just now, a short while back, we've seen a package of community quarantine. And I really like the idea, somewhere it's been very innovative. It's been a great initiative. And it's not about sending them home. I think they have done it at Manipur. It's about complete community participation. Here they involve community leaders. every member of the community. That way they become more responsible, more aware and more accountable. And they have even, somewhere talked about having different kinds of huts for people coming from the red zone or green zone or
Yes.
orange zone. So I think this has been very well planned. These are great initiatives that have been taken, perhaps thinking about long-term goals when maybe not all people who come back to the state will have sufficient space and resources to be quarantined in a facility or institution, and perhaps they'll not be able to go home also because of the associated risk. And that's why something like community quarantine and community participation has been thought about and talked about, and they have initiated this also. So again, I would repeat this, sending them home straight away involves a lot of risk. I think it needs to be analyzed properly and reassessed.
Dr. Vajri, again, Mr. John Kharshing, the Chairman, Grand Council of Chiefs, he had suggested that, well, some of the Darbars, were ready to put people in facility quarantines in the respective localities. Churches had come forward offering their halls. We have schools, we have community halls. Probably to start with, that could have been done. Because this is the first phase where we are handling hundreds coming from high-risk zones. We haven't done that before. So probably the first phase, say the first lot of 3 to 4 batches, we could have tried to put into facility quarantine, and then maybe when the awareness levels in the respective localities will be high, gradually we could have moved to home quarantine. Do you think that was also an option that the government, I'm sure, would have considered, but then decided to go with home quarantine for now?
Well, I think it's important to look at what is the bigger picture. How long are we looking at this? And it looks as COVID is here to stay for quite some time. So there will be a point in time where we will not be able to do this anymore. And how long do we keep on doing this? I mean, it's not like everybody is isolated. The world is so communicated right now. Everybody is moving in and out. We can't keep on doing this. But then, yes, I think at this point in time, we could have done something like that, put a facility quarantine, because we still don't have many people coming in. It's still manageable. And like you said, the door barshnoms, they can play a very important role. In my clinic, we've started clinic, and I have patients coming in to the hospitals, and when they go back, I need to give a clearance to the door barshnoms that this patient is okay, you can take them back. And it's already happening at that level. So door barshnoms are having their own protocols. Yeah, sometimes they're very, very strict. I'll have to go and they need to call me and tell me, did this patient come and visit you? Is she safe? Is he or she safe to get back to the community? And I have to tell them, okay, yeah, they're safe. You can get back to the community. So yeah, they're doing that at that level too. But I think right now we need to do a facility quarantine for these people. I think it's the best way forward. But at some point in time, when the lockdown eases, it will come to a point where we'll ease all of it. And so at that time, I don't think we need to do quarantine, maybe home quarantine, but then how good is home quarantine? We don't know.
Absolutely. Thank you. Thank you so much, Dr. Vajri, for your views on that. Thank you so much for your perspective. Yes, Sangeeta Datta, go ahead.
On a second thought again, sending them straight away home could have a silver lining too, because it could actually make the family members, rest of the family, very responsible, aware and accountable. Because now they have a person coming from outside the state and they're staying with them. Now each of them will feel, perhaps that's one way of looking at it also, maybe they'll start feeling responsible. They'll follow the norms and the guidelines of social distancing and wearing a mask, washing of hands, etc. Perhaps it's one way of making them more responsible and motivated when people are sent straight away home. So that could be another way of looking at it. Maybe people are more farsighted. Who knows?
Yeah, and again, as we mentioned, we have to think long term now with hundreds coming in, numbers. I mean, let's take for example the case of Fancy Bazaar in Guwahati. We have had over 340 samples collected yesterday.
That is exactly what struck me.
The State Health Minister was very clear about it.
Yes.
If even a sizable portion of these people test positive, we have to start tracing the mobile numbers, and we have to go for mass testing. So this is how serious things can get overnight, and that's why we should be prepared for any eventuality.
And that's exactly what struck me when I said this, because the state health minister did talk about a fresh challenge which was anticipated when people come back home. But we were not prepared for something like what happened at Fancy Bazaar, because it's because of lack of awareness, carelessness, etc. I guess each individual, each citizen will have to be more accountable, more responsible, and they have to be honest and sincere, because otherwise, facility quarantine will never be a solution. And I just hope, especially what we have seen in Assam in the last 2-3 days, I just hope the numbers, we are just talking about the returnees, but if we have more cases without any travel history, then I think the numbers will be too overwhelming for any facility quarantine to suffice. That way, ultimately, people will have to stay in their respective homes, or, so maybe we are heading towards that if we are not too much aware and careful. So it's high time we are careful, and maybe home quarantine will also, kind of motivate the people to get more careful and more aware, perhaps.
Just digressing a bit, I think I need to make a mention of this again. Assam Health Minister Himanta Biswa Sharma personally going down to the railway station to take stock of things. It gives a lot of confidence to the frontline workers, be it the doctors, be it the cleaning staff, everyone, and that is so important. Leadership is so important during these times.
So important, and we have always stated this, that hats off to him, and he's like a superhero now. And he has been there personally. He has been there to discharge patients in each district. He has been there at railway stations. He has been everywhere. He has been omnipresent. And trust me, this is not very easy for a human being, because at the end of the day, he's also a human being with his own, I would say, limitations and his abilities. But the way he's doing his work, the way he's, actually working, this is very exemplary, and he's a role model. I think he needs to be.
In fact, yesterday in a press briefing, talking to media persons, he said, people keep telling me, why do I need to go on ground? Why do I need to be everywhere, even in containment zones? Because if there is no presence, what happens? Even the cleaning staff is reluctant to go.
Yes.
Despite the wages, whatever, let's not talk about that, but even the cleaning staff is reluctant to go. And that's why this presence is so important.
Absolutely.
And this should show the way to everyone, be it the medical
student. People are looking up to him as a role model. People say, look at him, he is the health minister, he need not come here, but he's there. So, it motivates people.
These are fresh visuals from the Guwahati railway station there. As you can see, the Assam Health Minister Himanta Biswa Sharma again personally taking stock of things. As we mentioned, around 1,100 people, a train carrying around 1,100 people, most of them from Meghalaya, has just arrived. And there you see the Assam Health Minister taking stock of the situations, monitoring everything, monitoring every development. These are fresh visuals, Northeast Live exclusive visuals on your screen. There you see people getting down. These people have come all the way from Chennai, most of them from Meghalaya. MTC buses will be ferrying most of them to Shillong. Also, the train had people from other parts of the region, from Assam and other parts of the region. There we see the man in action. This is a very common sight in Assam now. He's everywhere taking stock of things. So a train carrying ferrying close to 1,100 people just arrived at the Guwahati railway station a short while back. Most of the people on the train are, of course, residents of Meghalaya, stranded people who are stranded outside, and around over 400 from Assam also arrived in the train. So close to 1,100 from Meghalaya, another 400 or 450 from Assam did take that train from Chennai. They've arrived, and there you see the health minister is on ground monitoring things, monitoring everything. We will keep on bringing you those fresh visuals from the Guwahati railway station. That's a wrap.